Disease state, cervical cancer. We're going to learn a lot about cervical cancer and treatment, symptoms, risk. What is cervical cancer? Cervical cancer is a deadly cancer that occurs in the cervix in the lower part of the womb by the lining of the uterus. It is leading cause of epidermis in the skin outermost layer, which proves and provides a waterproof shield and also determines our body's skin tone. Melanocytes, which contains the pigment melanin, are responsible of the discoloration of the skin, which lies just underneath the epidermis in the next layer of ability. Some facts and information about cervical cancer. It is a tumor in your cervix. Usually it is found in the lower part of the uterus. It is common in women in the ages of 21 to 50. So never be too certain not to check on yourself, making sure that everything is okay. It can be life-threatening. Smoking is associated with the squamous cell, which leads to cervical cancer. Sometimes after intercourse, you may have vaginal bleeding between menopause and most period cycles. That is also a cause of cervical cancer and leading in risk to cervical cancer. So this is just a diagram of your cervix. So usually in your cervix, if there is any type of epithelium vessel in the membrane, it will be in that area where the arrow is pointing at. HPV penetrates the epithelium and affects the cells in its base. If the infection persists, in rare cases, abnormal cells appear in the base of the epithelium. So this is just a diagram of showing you what it looks like on the inside. Some risk that you are able to detect if you don't detect that you have cervical cancer, and some risk factors that you may want to be precautious about. Having multiple sexual partners can also lead to increased chances of you getting HPV. Early sexual activities, starting sex early, will also increase your chances of getting HPV. A weakened immune system may likely to be develop cervical cancer if your immune system is weakened by another health condition. It's also a leading cause of HPV, which leads to cervical cancer. Smoking is also associated with it, and it also increases a risk of clear cell of a form of cervical cancer. So these are some preventions on getting to the point of cervical cancer. Always protect yourself. Speak with a doctor about HPV vaccines. It also lower your risk of cervical cancer or other HPV related cancers. Consult your doctor and see if their vaccine is something that is right for you, as it might be. Have sex in a respectable manner, taking steps to avoid sexually transmitted diseases, such as using condoms every time you have a sexual encounter. Pap smears on a regular basis. Precancerous disorders of cervix can be detected using pap smears, which can be controlled or treated to avoid cervical cancer. Routine pap smears tests should be started at the age of 21 and repeated every few years, according to most medical organizations. Quit smoking if you are able to. It lowers your chances of getting cervical cancer or any HPV related cancers. And also, if it gets to the point where you have a pap smear once a year and it comes back abnormal, they do a test called a colonoscopy, where you're able to test the tissue just to make sure it's not cancerous. That is also a part of avoiding or preventing cervical cancer. It is always good to know what your body is doing. There's always treatments that you're able to get if comes to a point where you have cervical cancer. It is treatable, it is avoidable, but you just have to make sure that you pay extra careful to your body. Medication that can help is chemotherapy. You can always speak with your doctor about getting that medication to where it can kill off the virus and cancerous cells. And adding a little bit of radiation also helps. Immune therapy is also used to stimulate a person's immune system to the point out this cancerous cells for a treatment so that it will not return. There's always other things that you're able to do, symptoms, and you're knowing that if you ever have these symptoms, always consult your doctor. Pelvic pains, vaginal discharge, if it's have blood or any foul odor, that is also a sign that you may need to get checked out. Just be very, very precautious of your body. Your cervix and your uterus is something that you should have, but things happen. But you taking that extra step to monitor your body and knowing and being your advocate for your body goes a long way.